Hello, my name is Danielle Covington, and this is my oral presentation on the effects of prenatal exposure to cocaine. There are I have examples of different drugs and their effects on the developing fetus. Um, the first one is thalidomide. Thalidomide was once prescribed in the 60s for expectant mothers. And if it is taken in the second trimester, it can cause birth defects such as shortened limbs or stunted limbs or missing limbs. Heroin and methadone are linked to such birth defects as low birth weight, prematurity, and toxemia. Newborns are sometimes given these drugs or a substitute for these drugs shortly after birth to combat the effects of withdrawal symptoms, and then they are slowly taken off or weaned off of the drugs after they are born. Cocaine has been linked to low birth weight, stillbirth, and birth defects. But more recently, research links it to more generalized growth deficiencies such as low birth weight, shorter length, and smaller head circumference. Um, this slower growth rate has been shown to continue through the age of 10. Various neuroimaging techniques show abnormal structure and function in children who have been exposed to cocaine before birth. The affected areas of the brain in these children are in the right inferior frontal cortex and the temporal and occipital regions of the brain. As far as cognitive development, prenatal cocaine exposure or PCE alone is not a factor. It basically combines with other socioeconomic factors such as a low quality home environment, a violent home environment, um, and other factors like low birth weight and prematurity. All of these combined in children that are exposed to cocaine before birth um, contribute to delayed cognitive development or impaired cognitive development. Children with PCE are 2.8 more times more likely to have a learning disability by age 7. Um, and this this study has been done in the demographic of African American children with lower socioeconomic status, and in populations with a more socially diverse socioeconomic status, there has been shown to be an increased need for an IEP. These children have also scored 2 to 10 points lower on language assessments. Um, through I forget what age, I wrote it down, but through the age of 17, these children have shown actually improved uh, language assessments, and this has been contributed to a more stimulating home environment with this older set of children. In conclusion, through my research, I found that prenatal cocaine exposure is not the only factor that determines intelligence delays and academic performance delays in children. There are some contributing factors such as socioeconomic factors that help to advance these delays in this demographic. As far as implications in my personal life, I haven't had any experience with personally with prenatal cocaine exposure. Not certainly not myself or anyone in my family. But career wise, since I'm going into the nursing program, there are some implications. Certainly, I would have to deal with populations where children have been exposed to not only cocaine but other illicit drugs such as, like I mentioned before, heroin and methadone, and maybe opiates or methamphetamine, or other barbiturates maybe, or other illicit drugs. And as far as being a nurse, that's a population that I would have to take care of, and possibly help the families or the mothers in the families to get the help that they need to end these addictions, and get their children the help they need to live a more productive life despite what implications there may be from prenatal drug exposure. And that ends my presentation. Thank you.